Dr. Roland Scherer is head of the new Desert Flower Center. Zenaid Demisse is hoping he can change her life. As a child, she was a victim of genital mutilation. Her clitoris was removed with a razor blade.
I want to be completed person, yeah? What they cut in us, I want to get back.
The surgeon performs complicated operations to reconstruct patients' genitalia. The surgery is free. It's part of a campaign against the ritual of female genital circumcision.
It's an age-old tradition that's been practiced in families for generations over thousands of years. This operation is to help women who have undergone circumcision to reverse it. It's not about actively encouraging them. We're just offering something that was unavailable until now. If it's what a woman wants, then she can come to us.
The project would not exist without this woman, Waris Dirie. The former model from Somalia has fought against female genital mutilation for over 16 years. She herself was also a victim. A clip from a movie about her life was shown at the opening for the centre this week. Even after so many years, the pain of her trauma is still raw.
All of those beautiful women who's been destroyed, if they can have something back to know, because they don't even give the chance to know what it feels like to be a woman. So if you can have a little bit of something that you can give a joy to be a woman again, then I thank you. I salute you, doctors.
But getting to this stage has not been easy, which is something Faduma Korn knows well. She's been helping women affected by genital mutilation in Germany for almost 20 years. Anonymously, of course. Families of the women are not allowed to know. Faduma was just 7 when her clitoris and inner labia were removed with a razor blade. She suffered a severe infection, which she is still affected by to this day. Her hands will be stiff forever.
They teach you that a clitoris makes you unclean. It needs to be cut off. This superstition and the way it's linked to some idea of mysticism makes young girls want to undergo circumcision. We think we'll be flawed if we don't, because that's what we're taught, when in fact, the opposite is true.
Faduma Korn is talking to a young woman. She wants to remain anonymous for fear of her family's reaction. Reverse circumcision wasn't her first priority, but after lengthy discussion with Faduma Korn, she agreed to have pelvic surgery, a major step.
I feel much freer. I can move easily and do sports every day. I can do what I want and it's all okay. I can finally go to the toilet without problems. That's the best of all. Before, it would take me 2 hours to urinate because it would only come out drop by drop. It was difficult.
But the young Somalian woman is angry at the way she was lied to, that she was subjected to such a horrific procedure and endured so much unnecessary pain.
My mother told me we were going into town to buy a treat. I thought I'd be getting something nice to eat. But then when we arrived at a house where there was a woman and then some other woman appeared, and they held me down and cut me. To me, it's butchery.
Female genital mutilation is officially banned in many African countries. But according to the World Health Organization, the ritual procedure is carried out every 11 seconds. It's supposedly a guarantee of chastity and sexual loyalty. Most women who undergo reverse circumcision do so in secret, or they insist the reason is purely medical, even in Germany.
Doctors who perform the operation in Munich issue a certificate that states the surgery was performed for medical reasons rather than personal ones. Even so, it's hard for parents to accept that their daughter, whom they went to great lengths to have circumcised and paid money for the procedure, would have it reversed, especially if she's unmarried.
Among the goals of the new Desert Flower Center in Berlin is to help young women like Sinead de Misse cope with the consequences of female genital mutilation and to give them back ownership of their bodies. It's a brave step that hopefully many more women will dare to take.